Which nutraceuticals or supplements can help, and how? Here are 6 immune-boosting supplements and what the scientific literature shows us. First up, vitamin C, then zinc, vitamin D, melatonin, glutathione, and acetylcysteine. These supplements come in various forms for administration. Liquids versus gels, capsules, tablets, pills, chelated nutrients, liposomal, sublingual, or intravenous. Back to the first one, vitamin C. It's water-soluble and antioxidant. It donates electrons in chemical reactions of the cell and does far more than prevent scurvy. It is a cofactor for several gene-regulating enzymes that support both the innate and the adaptive immune systems. This is in a 2017 paper out of the Journal of Nutrients. It gives strength to the linings of organs. It is found in an abundance in phagocytic cells like neutrophils, supporting all cell functions, and in lymphocytes, where it promotes growth. It prevents infection and promotes healing from infection. At least 100 to 200 milligrams of vitamin C per day is required for optimal tissue levels and plasma saturation, but higher levels are needed when infections are happening. Acute infection increases metabolic demand and turnover. This according to Vitamin C and Immunity. Publications note strong associations of low vitamin C, increased risk for cardiovascular disease, ischemic strokes, and hypertension. This mentioned in the Journal of Advanced Nutrition. Vitamin C dosing and best forms. Dosage. Upper limit for adults is 2,000 milligrams per day, but this doesn't apply to people using vitamin C for medical reasons, and they need a much higher dosage. Forms. Oral pill is the cheapest but has side effects in large doses, which are diarrhea and upset stomach. Liposomal form is 1.77 times more bioavailable than oral supplements, as per a 2021 article from the Journal of Liposomal Research. IV bypasses the digestive system and provides the highest therapeutic value and bioavailability. Who is prone to vitamin C deficiency? Malnourished, those with malabsorption disorders like celiac and Crohn's diseases, chemical dependence such as alcohol abuse, smokers, according to Medline Plus, pregnant and breastfeeding women, burn patients, post-op patients, active infections or illness. Next, zinc. It possesses anti-inflammatory and antioxidant properties. Zinc regulates communication between cells of the innate and the adaptive immune system and expression of genes for our immune system, according to a 2009 study. The Mayo Clinic tells us zinc shortens the duration of colds, reduces infections rates among the elderly, as in the article, How Zinc Helps You Fight Off Infections. Has a role in controlling the centers for maturity of T and B immune cells in the thymus and bone marrow, respectively. It strengthens the skin and other barriers, making them more resistant to infection. Zinc is needed by macrophages to make proteins that destroy pathogens. It will hasten healing with cold sores such as herpes simplex, according to Mount Sinai's reports. It's the main ingredient in many over-the-counter products like Zicam and Airborne. Recommended dosing and best forms of zinc, 8 to 11 milligrams for men and women respectively. This is from How Zinc Helps You Fight Off Infections. 40 milligrams is upper limit. Very high doses may have adverse effects. Forms: zinc picolinate, citrate, acetate, glycerate, oral. This from Mount Sinai. Sulfate is cheapest, but because it absorbs in the stomach, it can cause GI distress. Who is prone to zinc deficiency? All of us. Thanks to processed food, low zinc diet lacking beans, peas, seeds, and whole grains, as per How Zinc Helps You Fight Off Infections. Also, the elderly tend to be deficiency prone. Vitamin D. Vitamin D is technically a hormone because of its role in calcium absorption. Vitamin D, starting from both food and sunlight, is converted by the liver and kidneys into its active form, known as the hormone calcitriol. How much is needed for ideal health is a lot more than what's needed to prevent acute deficiency, which is called rickets, and osteomalacia. Some autoimmune and inflammatory diseases are associated with low vitamin D, such as MS, type 1 diabetes, per the Mayo Clinic and the University of Massachusetts Medical School. In a 2024 paper out of the Journal of Information Research, and the University of Massachusetts has said vitamin D supplementation leads to lower insulin dosage requirements and fewer diabetes complications later in life by protecting the surviving beta cells. It works against the production of those key chemical messengers, the cell mediators, critical to the progression of all inflammatory diseases, according to a 2014 paper out of the Journal of Inflammatory Research. Vitamin D reduces the risk of respiratory infections. Recommended dosing and best forms, at least 800 international units per day to prevent acute deficiency, but many health experts like the Endocrine Society recommend 1,500 to 2,000 IU per day for benefits beyond preventing deficiency. This is also according to Mayo Clinic. Get vitamin D levels checked a couple of times a year to be sure. That's the 125 OH. Some may need much more as genetics play a role. Sunlight, 15 minutes of direct sunlight exposure to bare skin can produce the most vitamin D needed in a day for lighter complected people, but not if it's cloudy. Vitamin D3 gel caps. Avoid D2, it is biologically inert. Beware, excess sunlight is a cancer risk.